Good morning, students. Today we will see about the family planning methods. It's an important question has been asked many times. What is family planning method? Family planning method is the method which the couples are voluntarily coming and deciding how many children they are having and decide what kind of the methods they will be used to plan their family is called the family planning. Mainly to regulate the number of children they want. They choose any of the spacing method or the temporary or method. In the definition itself, you can identify main objective is to avoid unwanted pregnancy, to bring out the wanted children, to regulate the interval between the children, to control the time of the birth, and to determine the number of the children. Family planning scope, if you see, it is give the spacing limit, and it is giving an opportunity to give the advice to the this counseling and other services, screening services, premarital counseling you can give, and you can prepare the couple for the preparation to the reduce the childbirth, and it gives opportunity to give the nutrition educations and the other adoptive services. The family planning are broadly classified into the two method. First one is the spacing method and will be the permanent method. Permanent method will be the male and the female method. Female. Male will be the vasectomy, female will be the tubectomy. The vasectomy will be a no scalpel vasectomy also in the on the table in the dressing room itself you can do it. But most of the men doesn't like to go for this vasectomy. They think that their sexual erections and sexual feeling will be getting affected. The female will be going for this will be the tubectomy. It also the corrective procedure. If at any case they lost their children, it can be able to recorrect and corrective surgery can be done. The next important one is called the basing method. Spacing method will be basically divided into barrier method and intrauterine device and the hormonal method and postcoital pills. The spacing, how you can do the barrier method mainly will be physical method and chemical method and combined method. Physical method especially will be the condom. Condom is called the Nirodh. Nirodh is coming form of a various flavored in a private sector. In a government is freely available in every primary healthcare center, sub health center, and ASHA and USHA are distributing this one into the periphery level of all the villages. Main advantages is easily available, no side effect, it light, compact, and it control the STD. The main limitation may be slip or may tear or reduce the sexual pleasure. What is called the female condom? Female can use the condom. Yes, it is made up of the polyurethane. It is covers the cervix. The ring is line the vagina, and also it is also spermicidal is being used in this one. External ring will be outside the vagina. Main advantages, it also prevent the STD, but the cost is little bit very high compared with the male condom. Another one, it is called the diaphragm. Diaphragm is called the Dutch cup. It is a synthetic rubber. It is made up of. It is inserted just before the sexual intercourse. Spermicidal also used here. There is no risk for this one, and it is the main disadvantage. Trained personnel is needed to demonstrate this one. Then if you go for the next about the spacing important method is called next to the barrier method. First will be called the IUDs. What is called IUD? IUDs are called the intrauterine device. If you see the first generation IUD, it is called the Lippis loop. Lippis loop is a S-shaped tube. It is a polyethylene plastic. It is a non-toxic. It is durable. It nearly come for 1 to 3 years with a comfortable manner. Main side effect, if you see, pain and the bleeding. And also the second generation IUD will be telling a copper T. This will be the copper T and then copper T 200 and Nova T and the CU 250 and 375. It is a 5 years effect. Even you can use for the nullipara women. The bleeding is comparatively very less and easy to fit, easy to remove it. Also, it's also used for the effect on the postcoital within 3 to 5 days. It's unprotected sexual contact. It can be also applicable. Then the third generation IUD, it is called the progesterone. Progesterone IUD, it is coming for a form of a levonorgestrone. It is also T-shaped. 35 milligram of the progestat is used. This is a hormone called progesterone. The level of the progesterone is increasing. It decreases the degrees level of the estrogen. It is completely unable to implant. So it does affect the implant. Next one, if you see, it is called the hormonal pills. Hormonals are called the oral pills. The oral pills are mainly by the combined pills. Combined pills means is a progesterone also will be there, estrogen also will be there. 100 to 200 microgram of estrogen and 10 milligram of the progesterone. 21 days you have to eat, and the 5th day you can start with your vitamin or iron tablet. It is the oral pills is form of coming as a form of maladi and malayan. Understand? And postcoital pills also, and other pills also will be used as called the mini pill, micro pill, and poorly used young women. Mostly these pills have a much in cancer risk or postcoital pills. The same levonorgestrone can be given within 72 hours of the intercourse, and you can use as a form of a tablet as well as in a IUD. Mifepristone all also coming as a form of this one. And if you see, and 1 month long acting quinistrol is a long acting with a short acting progesterone. So long acting estrogen and short acting progesterone is there. So monthly once you can take it as a 1 month pill. So what is this pills? And postcoital, as I told you, postcoital you can insert as a intrauterine device as a norprogesterone, levonorgestrone. Also you can give, if you don't like it, you can give it as a tablet form. Either mifepristone or the levonorgestrone 0.75 milligram has been given. Okay, all these tablets, who is a indication and contraindications? This is highly contraindicated for the people who are above 40-year-old or above 35 year. You can sell very well, because why? It is more risk for developing a cardiovascular diseases and carcinogenic agent. Metabolic effect will be increasing, so increase the BP and clotting, and glucose level will be increasing. Hepatocellular adenoma, ectopic pregnancy, birth defect will come, breast tenderness, breast fullness, and weight gain will be there. Migraine and bleeding will be there. So, these are the main contraindications for the oral contraceptive pills. So, whenever this question has been asked, you start with the what is called family planning. The definition: it's a voluntary basis where the couple, both of them, coming together voluntarily and selecting what kind of the method without any force and determine their family is called family planning. So you write what is the aims of family planning, objectives of family planning, classification of family planning in a broad way. That will be useful. Every section you have to write the indication and contraindication, advantages and limitation. If you write it, this will be useful for the getting a 15-mark question answer. Thank you.